Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. Hi there. So what is our medication of choice today? Our medication of choice today is known as the Human Menopausal gonadotropin. So this comes in different brand names such as your Menopur, Metrodin, Pergonal, as well as Repronex. So these are all brand names that this medication actually comes in. So what is this medication used for? So the medication is used for ovulation induction. It's used to cause ovulation in patients, or it can also be used in addition to an assisted reproductive technology, which is also known as IVF. So this medication can be used in these cases to help patients become pregnant or conceive. When it comes to the ovulation induction, this medication comes in intramuscular injection as well as a subcutaneous injection. So usually for the ovulation induction, patients will usually start with the 150 international units. And this can either be IM, which is intramuscularly, or subcutaneously daily for about 5 days. And the maximum dose patients are usually on is 450 international units. And this is usually used for a maximum of just 12 days. So in most cases, so the maximum duration of taking this medication is 12 days. Also, in terms of patient using it as an assisted reproductive technology, this medication is usually started at 225 international units subcutaneously daily, and this is begun usually cycle day 2. So your menstrual cycle starts on day 2 or day 3, and they usually adjust it based on how your ovaries are responding by day 5. So what are things to look out for while you're on this medication? So usually with this medication, common side effects is headache, if you start noticing an abdominal pain or abdominal fullness or nausea, as well as multiple pregnancy is a common side effect of this medication. So with multiple pregnancy, this can be a great thing if you've been waiting for a long period of time to conceive, and you actually find out that rather than one, you're having 2 or triple for your for the long time that you've been waiting, which is actually great news. So this medication can definitely help with that. So what is a very serious side effect that you definitely want to make sure that you're reporting to your doctor as soon as you start noticing? So with this medication, it is attached to a serious side effect known as ovarian enlargement or hyperstimulation syndrome. So usually in this case, patients will get like an abnormal stomach bloating or stomach swelling, which can just you feel very gassy and it's just very abnormal. Patients can start feeling that sensation, or patients can have like lower abdominal pain, any severe pelvic pain, any shortness of breath that's uncommon while taking this medication, as well as decreased urine or unusually low amount of urine. So if you notice that you're not peeing as much as you used to and it's very consistent, then these are things that you definitely want to report to your doctor while you're on this medication. Also, if you notice an abnormal increased weight gain, then you definitely want to let your doctor know as well. This is what I'm feeling like I'm gaining weight quickly. Is there something else that we can do in order to reduce it? Is this medication really effective, or is it causing more side effect than it is being effective? So these are definitely things that you want to discuss with your doctor. I would always tell my patients, definitely when you're taking a new medication, make sure that you're listening to your body. If you start feeling like this is not the normal me, and you've been having like a particular side effect, and it's just your body is really nudging you to that side effect, then you definitely want to make sure that you're calling your doctor's attention to it. That way they can take notes, start monitoring, do whatever lab work that it takes for them to do, and make sure that they're keeping tab of those side effects. That way they can make sure they're able to narrow it down and see what's actually causing that side effect. If it's the medication, that way they can stop it. If it's not the medication, that way they can point you in the direction that you should go in terms of reducing that side effect. All right, so what are other things to know about this medication? So definitely this medication is not recommended if you're already pregnant, so that kind of defeats the purpose. If you're already pregnant, then definitely you want to take medication that's going to help increase the growth of the baby, medications that's going to help aid you in terms of multivitamins, prenatal vitamins, to be specific, medications that will help aid the growth of the baby, rather than this medication that's used to induce ovulation. When you're already pregnant, ovulation is not needed. So with this medication also, you want to make sure that you're continuing your doctor's appointment, making sure that you're going through the necessary lab works to make sure that this medication is working, to make sure that they're checking those hormonal levels, to make sure that this medication is actually what you need for conception, and in order to help with your intent, which is conceiving. Also with this medication, it can increase, as I said earlier, multiple pregnancies. So you can increase the chance of multiple pregnancy in terms of triplets, twins, quadruplets. So making sure that you're aware of that and letting your doctor know if this is going to be a preferred choice, or maybe you just want to have one baby and just call it a day. Make sure that you're telling your doctors, asking your doctor questions, letting them know your concerns when it comes to this medication. Also with this medication, it can increase the risk for what they call ovarian torsion, and this is what usually when the ovaries are twisted or the fallopian tube area is twisted to the point where blood flow is actually cut off from the ovaries or fallopian tube area. So this is definitely a very serious condition, so definitely your doctor wants to monitor that while you're on this medication. So it's, like I said, it's very important for you to make sure that you're attending your doctor's appointment. Also, in terms of conception or trying to conceive, you want to make sure that you're limiting your workout session. So if you're the type of person that's just starting the gym, this is not the time for you to be doing a rigorous, intense, body training at this period in time. So that way you can give your body some rest to be able to accommodate the new baby, and also kind of be able to tell if it's an ovulation period for you. That way your body temperature is not all over the place because you're working out and burning all this energy, and your body's not able to kind of differentiate between, okay, this is the ovulation basal or body temperature compared to your body just being hot due to the energy that you're burning. And also just to kind of prepare your body in general for the fetus, it's recommended to kind of limit your workout to in the meantime while your ovaries are being stimulated. All right, so with injecting yourself with this medication, you want to make sure that you're washing your hands before and after use, also making sure that you're disposing of your injection properly. The last thing you want is someone else to come in contact unintentionally with your injection. So also when it comes to the vial or injection that you're given, making sure that this has the right color of solution in it. Usually the medication will come with a package insert, or you can also Google it as well. What is the color of my injection? What is it supposed to look like before I inject it? So you want to make sure that the drug is intact before injecting it in your body. Also, when it comes to injecting yourself, you want to make sure that you're rotating the site to avoid any injection site reaction like irritation, redness, or swelling around the area. That way you can avoid that. I would attach a visual of how to kind of rotate your injection site when you're injecting yourself with this medication. That way you're not just injecting the same area and the same area is getting irritated. Also, this medication can increase risk for blood clots. So if you start noticing any abnormal chest pain, any eye pain, abnormal consistent headache, any leg swelling or pain in your lower limbs, you want to make sure that you're reporting that to your doctor. If you do have a feeling that it is a blood clot, make sure that you're going to the ER immediately. That way they can get that treated. Also, if you start noticing any symptoms of a condition known as ectopic pregnancy, I will link a visual also in this video. That way you can see what I'm talking about. Or any ectopic miscarriage, you definitely want to reach out to your doctor regarding that as well. So I hope you were able to enjoy this video and learn one thing or two about how to take the medication. If you do have any medication that you're taking other than this that you would like to get more information on, feel free to comment that in the comment section below, and we'll review it and be sure to get you more information on that video. Also, if you'd like to do a one-on-one consultation with our pharmacist here at DamiRx Care, you can go to our website at www.damirxcare.com. And thank you for watching, and stay blessed.